Okay, this video is a lecture about brain anatomy, and it's going to be from this, it's a chapter from this book, Chapter 9. The book is Medical Reformation and Vegan Renaissance Bible by me. We're going to go through a amount of brain anatomy so you'll make sense of all the stuff, because we're going to talk a lot about how do you prevent dementia, and and it just helps having some general understanding of the brain. I teach brain anatomy to residents, medical students, even the fellowship trained neurologists. I teach them advanced brain anatomy. Okay, so this right here is the lateral view of the brain. This would be like if you cut the brain right through the midline. It's called a sagittal. So it's a side-on view. It's not the outer side. It's the inner middle of the brain, a midline split of the brain. Okay, there's something called the triune or three-part brain of McClean. He was a Harvard neuroanatomist. And it's sort of an evolutionary idea that the brainstem right here, midbrain, pons, and medulla, that then connect to the cervical spinal cord, are the reptile brain. All right? And then built on top of this, so the reptile brain is almost like your fist. Okay, your fist like this, with this being your spinal cord, your medulla, then your pons where it kind of puffs out, and perhaps you could say on top the midbrain right there. Okay, so that's your reptile brain, and that's thought to be just primitive stuff, maintaining a heart rate, maintaining blood oxygen levels, and the simplest, desires. Okay, I want food, I want sex. Okay, the next level up, shaped like the letter C, like on a Chicago Bears football helmet, and that is from the cingulate gyrus. This right here is called the cingulate gyrus, and then in continuity it'll extend. It has a connector called the isthmus, and it'll connect into the medial temporal lobe. And that's called the limbic brain or the mammal brain. So brainstem is down here is the reptile brain. Then the limbic system is the mammal brain. That has more sophistication. A reptile just lays its eggs and walks away. Okay. With a mammal, it has to nurse its babies, and it has to take care of them more. It has more responsibility. So a much more sophisticated brain in a mammal than in a reptile. But it's very impulsive, very emotional. Okay, like think of your dog, okay? It's loving and kind and nice in a lot of ways. On the other hand, it's pretty simple and primitive, all right? All right, so the next thing, and then built on top of that, is this whole big superficial cerebral cortex. And this is basically the human brain. You can also call it the primate brain, but one thing, too, will just make clear, our cortex, cerebral cortex, is like 3 times bigger than a chimp, okay? I get annoyed a little bit when people say, oh, we're just like a chimp. No, we're way, way, way more smart and sophisticated than chimpanzees. And I even have entire videos about that subject from before. So basically, the outer brain is the cerebral cortex. And that's your thinking brain. Especially the anterior. The more anterior you go in the brain, the more you have sophisticated thinking, abstract thinking, delayed gratification, the unique personality of the individual. Okay, but the whole point of this was the vertical construction of the brain. So primitive, reptile, basic needs, then mammalian, limbic system brain of knowing enough to raise a family, and then on top of that, all of that human cerebral cortex for much, much, much more advanced thinking. We're the only animal that that can count to 10 and can read and all this other advanced, sophisticated stuff. Okay, now we didn't mention the cerebellum. The cerebellum is located, this lower part of the brain, the brainstem and the cerebellum are located below what's called the tentorium. Tentorium is like a fascial sheet that separates the supratentorial brain from the infratentorial brain. The cerebellum, despite being relatively small in size, contains about 70% of the neurons in the brain, and a lot of those are short interneurons for like doing delicate tasks like writing with a pen. Okay, that requires very precise coordination. So short interneurons, they're a bunch of little feedback loops to precisely coordinate one's movement. The ability to move our hands in a dexterous fashion enables us to do all kinds of things, which enables us to get smarter and to learn more on why we're so much smarter than a chimp. Chimp's really strong. They're like 3 times as strong as us for climbing through the trees, but they're quite stupid in their reasoning levels, and they're not as coordinated as we are for doing things like I just showed you with writing our name with a pen. Okay, then that also brings us something called Moravec's paradox. Moravec's paradox is the idea that the hard problem is easy and the easy problem is difficult. So what that means is scientists back in the 1950s with artificial intelligence, programmer robots, or computers, could make a computer do calculus back in the 1950s, but even to this day, they can't really make them move quite like the way a human does. They're certainly getting better at that. But what I'm trying to say is it takes tons more computational resources to move in coordinated fashion than it does to do a calculus or another math problem. All right. Okay, so then the next thing too comes up is, why do humans have brains? Why do animals have brains? You know, Voltaire had asked this question back in the 1700s. So the reason why we have a brain is because we move. Animals have brains because we move. As soon as you move, you have to make a value judgment. I will go towards that over there, the food, the fruit tree. I will avoid that over there. Looks like trouble, a bunch of coyotes. You then have to navigate to your destination. You have to avoid obstacles on your path. You have to have a memory to remember how to get back where you came from. And of course, you have to have the ability to decide, yes, going towards water would be useful to me. You know, walking to the edge of that cliff would not be so useful. So you have to have that decision making. Okay, so we need to have a brain because we move, but all animals have brains, even the stupid little like worms and simple animals like that. So a smart animal like us, why do we have such a big brain? What is the purpose of the human brain? Why is it that we can live in all kinds of different environments? Okay, here's the reason. The purpose of a human brain is so you can walk down a path in a forest, a jungle, or a prairie and survive. Okay, that's what it's about. So your brain is based on reality. There's no BS with the brain. I love the brain. It's the most interesting thing, I think, in the whole world. Okay, it's really interesting. Okay, and what it can do. Okay, so we're going to talk a little more about that. So we went through the vertical organization of the brain. Just remember that as McClean's three-part brain: reptile, mammal, human. All right. Now we're going to talk about the brain from front to back. Okay, all the way in the back of the brain is considered to be purely sensory. This is the occipital lobe. The occipital lobe is for vision. Also, by the way, for looking at a brain, let's see here if I can give it to you this way. It's like a fist. The thumb right here is the temporal lobe. That's especially for hearing. Auditory cortex is back in here. Okay, then we have the frontal lobe. We talked about that. That's for thinking, making decisions, and also the precentral gyrus is for motor. Okay, then right behind this big midline crease right here is the parietal lobe. And the parietal lobe is for touch sense, you know, sensory position sense, vibration sense, but especially think of it as being for touch. Okay, and it's also, well, that's all you need to know about it for now. And then way in the back is the occipital lobe. And then right where all these lobes come together, so right about here, that's a multimodal association cortex that can take information from the temporal lobe, like auditory, from the parietal lobe, like touch, vibration sense, kinesthetic sense, position sense, proprioception, and the occipital lobe, vision sense, and integrate all three of them. And then once it's done that, it sort of sends a message to the temporal lobe, you know, inferior, like the facial recognition gyrus. What am I looking at? Who is this? And then it sends information in the frontal lobe. Okay, here's the information. Okay, boss, what do we do? All right, so that's pretty much how the brain works. And so basically, the more posterior you are, the more purely sensory you are. And of course, you got the visual sense, and more resources are devoted to vision than any other senses. It's really important. Your position sense, and then your auditory cortex, your hearing sense, that gets integrated and then sent to the frontal lobe. Then the frontal lobe makes value judgments. This is good. The fruit tree is good. I am hungry. I will walk to the fruit tree. Okay? And the front tree also delays gratification in the sense that it'll say things like, okay, right now, I'd love to go play sports with my friends, but I have to eat and I have to obtain food for my family or my girlfriend or something, so I'm going to go climb the fruit tree and pick fruits, even though I really want to go with the guys and play sports or something, go to sports practice. So that ability to delay gratification, to recognize the long-term consequences for one's decisions, are all things that are quite human. They're a more advanced level of thinking. Okay, so that's the brain from front to back. Okay, now we're going to talk about the brain from side to side. Okay, the brain from side to side, we'll talk a little bit about the right brain and the left brain. Okay, the right brain, so the way you think of a brain is, imagine you walk into a room and the patient's feet are facing toward you. So this would be the patient's right brain and the left brain. Imagine again like their feet are facing towards you. Okay, so the left brain is what you think of for language. You can remember L for language, L for left side, and it's a type of language that's relatively simple. You know, can you please pass the salt? Yes, thank you. That's like left brain language. The right side of the brain has been called the artistic brain. It's more creative, it's more free flowing, it's more holistic. And it's also involved in language, but it's more like a sophisticated level of language, like understanding jokes, understanding metaphors, like singing. There's some people who will have a stroke, which limits their ability to speak, but they can still sing. So the two are complementary, all right? But you'll usually hear the left more strongly associated with language skills. In addition, the left side of the brain tends to be associated with deductive reasoning, almost a predator mentality. I will run at such and such a speed, and I should be able to catch that antelope or whatever animal it is at this speed. Okay, and what I'm saying is, and also men are a little more predatory in a sense, and women are a little bit more like prey, if you will, in some ways. We chase after them, they don't chase after us. We're more attracted to them than they are attracted to us. Okay, but that deductive reasoning is very characteristic of left brain. The left brain tends to be more sure of itself. It's sort of focused on details. And the left brain is what you use in school to take a Scantron test. Okay, the right brain is a little more open-ended, and it's more of a inductive reasoning. It's more of a prey mentality. So there's a great talk. It's an animated talk on YouTube. The person giving the talk is Ian McGilchrist. He's a psychiatrist, I think, from England, and he even wrote like a 500-page book about the difference between the right and the left side of the brain. You don't need 500 pages. What I'm telling you here is more than enough, but you get the point of it. And so the right side of the brain is a little bit more like prey. It's more aware of its surroundings. So there's a picture, he has a really nice picture in this video of a bird, just pecking at little breadcrumbs. And while it's pecking at the breadcrumbs, that's kind of like using the left brain. I'm going to eat this piece and this piece and this piece off the ground. And then the right brain is more of the sense of, well, there's a raccoon coming at me over the fence. There's a hawk over there in that tree. There's a man walking a dog. I have to be aware. If the man walking the dog comes any closer, I'll take flight. If the hawk comes after me, I'll have to fly low through these bushes because it'll have a hard time navigating its big wings in that area. So that type of thinking, that inductive reasoning, is characteristic of the right brain. All right, so that is the big right-sided, left-sided differences. Okay. The left brain is also a little bit more like doing your job that you're pretty familiar with. The right brain is more like creative, painting something or thinking of the words of a poem, the artistic brain. Actually, let me tell you about the networks. I'll go into the networks. I don't know if I got another slide for networks. I forgot if I do it or not. You have such a thing as called networks. In general, the midline right here, like the cingulate gyrus, this is a cingulate gyrus here. That in continuity, it'll curve into this medial temporal gyrus. But this cingulate gyrus right here, the default mode network is associated with, if you have a patient, you tell them to sit on an MRI scanner, close their eyes, and you ask them, so what you thinking about? They're usually going to say they're thinking about relationships, their family and friends, their girlfriend and boyfriend. And the reason for that is, primates, we don't do so well when we're alone on our own. We very much benefit from social behavior, our relationships. So they're important to us. And usually if you ask somebody, close your eyes on a functional MRI scanner table, they'll say, oh, I'm thinking about, yesterday, my girlfriend wanted to go with me a movie, but I couldn't go because I had to write this paper for school. So I know she was a little annoyed with that, so I'm going to go with her tonight. And so it's basically navigating back and forth between the past and the future, past and the future. So this area of the brain right here navigates the past and the future. So it's time travel in a sense. And a lot of times, let's say a person's sad. They're obsessing. Oh, I'm so sad because of, whatever the event, okay? She dumped me and I thought I was going to marry her and we were going to live happily ever after. Now I'm on my own again and I don't even have a replacement chick for her, and who knows when I'll ever find one. My life sucks. I'll never have children. My whole life sucks. A person can start ruminating and obsessing, and again, they're sort of obsessing on the past and going back and forth, past and future, past and future. So the point is, on the outer surface of the brain, because it's kind of rounded, it's convexity, it's convex outward, it's called the convexities of the brain. We have what is called a task-based network, and that's for being involved in the present, doing an activity. And so the point of this is that if you find yourself kind of sad and obsessing about something that's really a waste of your time, worrying over trivial nonsense, just getting busy with a task. It could be exercise, it could be interacting with other people, it could be doing your job, whatever it is. that will take your mind off whatever had been bothering, because we can only concentrate consciously on one thing at a time. So one of the best treatments for an unhappy, sad, depressed, anxious person is just get busy with something. And that's another reason why exercise is therapeutic, because they're now focusing on lifting the weight or navigating the forest as they're jogging. Okay, so on the outer surface of the brain, that is a task-based network. In the center is a default mode network. Task-based network is for dealing with the present. Okay, default mode network is for dealing with the past and the future. So that's how the brain time travels. All right. Right in here, this is called the insular cortex because it's like a little island. Imagine you came, this is the Sylvian fissure, the space between the frontal lobe and the temporal lobe right in here. Imagine you were on a little boat sailing around in the fluid outside the brain called the cerebral spinal fluid. You can navigate the boat down the Sylvian fissure and you come to this area. This is called the insula. Think of it like a little island. All right, and the relevance is right along this insula is what is called the salience network. Salience means to pay attention to something. So if you were sitting here and let's say the TV was on next to you, you couldn't help every time you see motion taking a look over there. You just would. We're naturally designed to do that. And the reason you can make sense of it is imagine you're in the forest and you see motion. Well, you better look and figure out what that motion is because it could be a predator coming towards you. In the periphery of our eyes, we have a lot of what are called rods that are black and white vision that are very high in their motion sensitivity. So we detect motion pretty well in our peripheral vision, and then we turn our head and we look at it with stereoscopic vision, having both eyes on something, because then we can use the center of our eyes, the center of our retina, our fovea, where there's very concentrated cones for color vision, and you have the highest possible resolution with maximal color appreciation ability, such that you can tell, oh, that's what that is. Oh, it's just my dog running up to me. He's happy to see me. Hi, how you doing, buddy? Okay, that's good. On the other hand, oh crap, it's a predator. I better run, climb a tree, or be ready to defend myself. So that's how the brain works. And so the point is, if you're studying or trying to accomplish something, you want to minimize distractions. No TVs in the room, no other things. Get your phone out of the room, and you can really do some real work, for example. Okay, so what we just talked about there is that's how the brain time travels. Cingulate gyrus is to travel past and future. Task-based network is to be in the present. Salience network, takes us back and forth, so we want to shut down distractions if we're busy. All right. One more thing I will talk about is our memories. This is the hippocampus, this inner part of the medial temporal lobe, and that is especially important for forming new memories, and it's especially for things that you would call declarative memory. Declarative memory means that you could say it. Okay, this is a blue pen. This is a red pen. That's declarative memory. And there's different types of memory. There's also episodic memory. I still can remember when I was in 7th grade and I kissed a girl for the first time, okay? That's for episodic memory. You can remember an episode from your life, okay? And then there's a third type of memory that would be procedural memory, like riding a bike. It's relatively difficult to explain that. It takes more words we feel than it should, but we just get on the bike. We know how to ride the bike. I haven't ridden a bicycle in a couple of years, but I could get on a bike and ride it tomorrow, okay? So that's procedural memory. Another thing about declarative memory, though, and episodic memory that I want to emphasize is how do we learn new stuff? How is it that we take new information, we stick it in our brains, and we know what we just memorized, we know how to retrieve it, we know how to compare it and contrast it with the other things that we know, and that is what is called, how do we do that? We do that by forming comparisons, and the comparisons can be called analogies or metaphors, similes. This is like this. Okay, so what I'm saying is all new information that comes into our brain for forming declarative memories is done by metaphors, analogies, and comparisons. So, it's like you're talking to a kid. Okay, that's a cat because it goes meow and it has 4 legs, see it walking by, but that's a dog because it goes bow wow, okay? So then the kid knows cat meow, dog bow wow, all right? So that's how we take everything. We form it into categories and we make those categories based on comparisons, based on metaphors. So that's my point. Like when you learn something new, it'll initially come in and you'll have this temporary buffer memory where you'll just have a spot view of something for a moment. But if you want to stick that into long-term memory, what you should do is you should be comparing it and contrasting it with other things, okay? This fruit, it is kind of sweet. This apple, it reminds me of pears. They're also sweet, but the apple is red and the pear is yellow, whatever. All these little comparisons and being aware of the nuanced differences between the two things, that enables you to remember something long term. So a lot of times, like when I study something, let's say I know I have to know this 6 months from now, I'll spend a long time really playing with that material. The more you can, make it logical and compare it to a bunch of other things you know, the more likely it's going to stick into your brain long term. Okay. Oh, by the way, that hippocampus, which I just showed you, let me show it again. The hippocampus is very sensitive to being hypotensive, lack of blood supply, oxygen supply, hypoglycemic. So the most important area of the brain, hippocampus, is also one of the most delicate areas. So you really want to be careful about your brain health. Dementia is so common, not necessarily frank, full-blown dementia, but mild dementia, it's super common. I see it all day long, every day. All these people that are real slow, kind of like cows. All right, now here is this is a transverse section of the brain. We call them axial in MRI and CAT scan because we're describing it as being relative to the spine. The spine is called the axis of the body. Okay, so at this level, and of the brain, and I can show you, actually, let me just go back to that picture there, and I'll show you where it was on that last picture. This right here is the level of the basal ganglia. These are the deep nuclei where the cell bodies are located in the center of the brain. So this would be the thalamus, hypothalamus. This would be, the globus pallidus. This would be the putamen, and this is the insular cortex. And by the way, the regular cerebral cortex is like a ribbon all around the periphery of the brain. Cortex in Latin means bark, like the bark of a tree. So that's why you have a gray matter cortex around the periphery of it, if this were a tree stump. Okay, this level right here is the basal ganglia level with these deep gray nuclei. Gray is for gray matter. It's the color that cell bodies look on gross anatomy. That means open to our eye, our macroscopic vision. At the level of these ventricles, this is where cerebral spinal fluid is. The brain's bathed in fluid. This level right here is called the periventricular region, or the corona radiata. If you look at it in cut section on gross anatomy, it looks like a crown, the crown of a king, and it radiates out in a circle. So this is the corona radiata. We're going to need to know that. The reason why you want to know these terms, if you're talking about brains, is you have to describe where lesions are, where strokes are. In any given day, I can see 1,000 strokes. Okay, when I see 1,000 strokes, what I mean, most of those are small, silent strokes. I don't see that many big strokes. In the course of a day, I'll see maybe 2, 3 big strokes, but I'll see tons and tons of little silent strokes. All right, then up here above the level of the ventricles, now we're in what's called the centrum semiovale. It'll make more sense in a moment, but those are the 3 levels: basal ganglia level, corona radiata level, and then higher up is the centrum semiovale level. Okay, so here is an axial or transverse image through the basal ganglia. In the front, you got something called the caudate nucleus. Right here is the GP for globus pallidus. Here's the putamen. I remember this way. This is the internal capsule, by the way. And the corticospinal fibers, the ones that go to the muscles to move our arms and legs, are located right here in the internal capsule. This mnemonic HAL means head, arms, legs. Okay, so the fibers for those tracks going from the cerebral cortex, motor area, down into the spinal cord, into the arms and legs. Right next to them is a globus pallidus. This is called the internal capsule. So I remember globus pallidus is pals with the internal capsule. Putamen's on the outside, so I remember to put a man out. He pissed off his girlfriend, pissed off his woman. He's in the doghouse for the night. Okay, so, and the reason why I briefly went through that anatomy is this is something that all medical students have to memorize, all radiology residents have to memorize. This is pretty classic stuff. And here's the thalamus and back. Why would anybody be asked to memorize this? Because this is where tons of strokes happen. Hypertensive strokes happen here all the time. Every single day, I always see at least one hypertensive stroke in this area. Okay. The hypertensive stroke puts a little hole in the brain, and another word for hole is lacuna. So these are called lacunar infarctions. And I jokingly wrote here on this thing that this is stroke land. So I call this stroke land in the basal ganglia. Like I said, I'm always seeing strokes here all day long, every day. All right, the hypertension, the high pressure of the blood will shear off these little lenticular striate arteries, and they'll often be small hemorrhagic strokes. Small hemorrhages, not big hemorrhages, is the characteristic thing. Oh yeah, and don't leave your car running and sit there inhaling this stuff. Okay, that's pretty stupid. I mentioned there, all right. All right, so here is the brain higher up. Now this is above the level of the cerebral ventricles. And the center of the brain is a deep white matter. White matter in the brain means myelinated fibers. Okay, so this is the center of the brain. And the whole brain above the ventricles is kind of shaped like an oval, so we call it the centrum semiovale, semi-oval shaped thing in the center. All right. And again, the reason for caring about the name of these locations is just this is where most disease happens, so you can precisely describe it. Heroin addicts will sometimes get something called a leukoencephalopathy. Leuko means white, like white matter. Encephalopathy just means brain disease. Okay, so they'll destroy their deep white matter. You know, heroin is totally stupid, and the opioids are related to that, and many, many thousands of people are dying every year from side effects of opioids. So my advice is if they offer you opioids for pain medicine, don't take them, okay? Now people will lecture me and say, oh, you shouldn't say that, you know, we need to worry about pain control. You know what? I know I've seen a lot of people die from opioids. I think they're a bad idea, okay? There might be some special circumstance, you know, an end-stage cancer patient for pain relief in that context. But for a regular person with just, you know, some minor pain that's going to heal up in a couple weeks or months, I wouldn't take opioids. Okay, all right, now here's getting into a little more interesting brain anatomy. So this is, again, we talked about the basal ganglia level here at the level of these deep gray nuclei where there's a lot of cell bodies. And then here's a corona radiata at the level of the lateral ventricles. The blue stuff here, cerebral spinal fluid, is located in those lateral ventricles. Here's the centrum semiovale, the higher level here. And then I drew a skull and crossbones right here because this is where you get tons of silent strokes. So down at this level, these little arteries that go into the basal ganglia, this is the internal carotid artery, goes up into the brain. It bifurcates into an anterior cerebral artery we're not going to include on here because it makes things too complicated. But here's the middle cerebral artery. And it gives off these branches through the basal ganglia. They're called lenticulostriates, but just remember them as, you know, the basal ganglia arteries. And the hypertension will often injure these arteries at their base, even shear them off a little bit. You get little hypertensive hemorrhages in here. And you can also get big hypertensive hemorrhages, but big hypertensive hemorrhages are very rare. Little tiny ones within lacunar infarctions are very common. Okay, the next thing is if you overtreat your hypertension, you drop the pressure, and these are sort of end-stage vascular territories, and you can stroke out in your corona radiata or centrum semiovale in this region near the ventricles. If you don't treat your hypertension, you just keep on damaging the vessels from the high pressure and develop atherosclerosis in them, and that can also lead to the same effect. So little strokes in this area, often they're asymptomatic, but the person just keeps slowing down cognitively. Like I said, the same patient can have over 100 of them in one patient. That's why I say I can see over 1,000 in a day, because some patient might have like 200 of them. Okay. And these are the convexity arteries. These are the penetrating arteries, and these are sort of like end artery territories without good collateral, meaning that they don't have, if they lose the one main vessel, they don't have much left to keep them alive. Oh, peri means next to. So periventricular would be next to the ventricle. Okay, this is just a real quick picture of brain anatomy, and this would be the lateral part of the brain, the outer surface, the convexity, if you will. And I just want to show you, like, how do you memorize complex things? When you want to memorize something complex, you should look at it carefully, like get a couple different books, a couple different pictures, and then ask yourself, what's the irreducible minimum from which I could derive all the rest? And on the lateral surface of the brain, it's the anatomy of the Sylvian fissure right here, which looks like a snail. And once you know the snail, you can kind of figure out all the names of this other stuff, which we don't really need to do for our purposes, but I'm just showing you that's an example of how you memorize complex stuff. You figure out what the irreducible minimum is, and then you figure out how to connect that to everything else, and just memorize the irreducible minimum, and you can later on derive the rest. Okay, here is showing the fluid system of the brain. And the yellow stuff is cerebral spinal fluid. The whole brain is bathed in fluid. And the initial thing I first learned is, oh, well, that's like a water helmet in football. It protects the brain with trauma to absorb some of the shock of the blow, such that it's like a shock absorber. Okay, and yeah, it does that, but it has much more important things too. The cerebral spinal fluid is like the sewage system. At night, when we're asleep, our brain neurons pump out their waste products, and they get taken into the cerebral spinal fluid. and then it rinses them away. So it cleans the brain. Some of it's reabsorbed into the arachnoid granulations next to the venous sinuses. So these are the big veins around the brain called venous sinuses. And they're partly involved in reabsorbing waste products that the brain cells excrete at night. The brain cells have to excrete their waste products at night when you're asleep because that's the only time they can go on offline. In the daytime, while you're awake, your brain cells have to be accurate and they have to be with it, so they can't shut themselves off and excrete their waste products because you have to maintain a precise neuronal milieu, extracellular matrix. Okay, I'll show you another picture of how that all works. Okay, here's another cross-section of the brain, and in this picture you can see here's the superior sagittal sinus, the big vein on top. You imagine this all being blue vein. There are lymphatics in the brain in the dura mater. They're not in the brain parenchyma itself, but they are located in the dura, and those are also related to absorbing fluid. So the waste products, some of them go into there. Okay. Dura means hard, mater means mother, and it's basically the outer protective layering around the brain right attached to the skull. Okay, now here's looking at the brain cells up close. These are the neurons, and these are their little waste products. These little brown things look like little turds that they pump out at night. And it's like Victorians, putting their chamber pots and dumping them out into the street. So at night what happens is, again, you can't vary the extracellular matrix in the daytime because the neuronal electrolyte gradients have to be precise. But at night, the neurons can go offline, and the perivascular space of Virchow bin around the artery, that's what the space is called, it opens up and more fluid rinses around the artery. And then from the artery, it passes sideways through the brain tissue, the brain parenchyma, and it'll rinse over these neurons and rinse their waste products into the perivascular space around the vein. So this is an A for artery, red. Here's a V for vein, blue. And this happens at night, and these green cells here are glial cells. Glial means like glue and supporting cells. And so the combination of this process is mediated to some extent by these glial cells. The astrocyte foot processes, they'll allow more cerebrospinal fluid to rinse over the brain parenchyma, and that'll rinse away the waste products. So what this means is you just cleaned your brain at night while you were asleep. So when you first wake up in the morning, your brain is totally clean, your neurons are fresh. That's when you are at your intellectual best. So that's another reason why I don't eat breakfast. I want to do my best intellectual work always in the morning. Plus, if I'm going to work, I want to sleep, get a little more sleep. That's another reason to not eat breakfast. I told you before, I think that whole breakfast thing is overrated. It was advertising by the companies that sell breakfast food. Okay. Here's just another point. Yeah, I always do whatever's most complicated for me intellectually. I do that first thing when I wake up. The midbrain, so here's the midbrain on this side view, the sagittal view. Here it is on a transverse section, an axial view. A normal midbrain has what's called substantia nigra. Substantia nigra just means black stuff. Okay, and it'll normally have like a swallowtail. With Parkinson's disease, the swallowtail component will be sort of just blobbed together like coalescent. And you'll sometimes see that, and that can help you diagnose Parkinson's. It's really, in real life, a lot of times there's motion artifact on a susceptibility weighted sequence, so it's not as easy as that diagram would imply. Okay, let's see here. Well, that's all I was going to show you for anatomy. You got the main point. So the main point was just, the brain organization from top to bottom, McClean's triune brain, three-part brain. From side to side was just the differences between the right and left brain, as well as then the networks. Present, outside, task-based network. Center is past and future default mode network. And then salience is in between the two for where your attention is going. And that if you're obsessing at rest on one thing, just get busy with exercise or something else and you'll feel better. From front to back, and front is the complex abstract thinking human personality, and the back is mostly sensory like vision. And then why do we have a brain? So we can survive. Okay, and right brain is the artistic brain, left brain is like the school brain. So anyways, that's an introduction to the brain. Hope that was helpful.